In this video, I want to go over Plan N, Medigap Plan N, and the reason for this is I got a call from someone, not out of the blue. I spoke to this person a few months back, and they called me back months later, and I actually thought that they went with another agent or something, but they called me back and said, I'd like to go with the Medicare Supplement Plan N. And this is not surprising to me, but it was surprising that someone called me out of the blue to go with this, because usually when people call me and they know specifically what plan they want, it's either a plan G or it's a plan high deductible G. And when I asked him what made you choose plan N, he told me some specific things that I'm going to go over in this video with you. If you don't know who I am, my name is Brian Monahan. I've been working with people going on to Medicare for the past 15 years. I've been a licensed agent now in 46 states, and I work with people to help them choose a plan that's best for them. And one of the things that I always tell people is there's only 3 Medigap plans that I actually put people on, and they're on the screen right now. And in these videos, I try to go over the raw numbers so that you can understand which plan is best for you. So let's jump into it. So on top, we have Medigap Plan G, then we have Plan N, and Plan High Deductible G. Now, most of you already know, as you see the Medicare A and B card on the screen, on average, you're going to pay $164.90 a month for this card in 2023. That's an average. If you make more money, you're going to pay more than that. Certain plans give you money back on the Medicare A and B card. Some people get it for free. But on average, $164.90 is what you're going to pay each month to the government. Now, on top of that, you're going to have to choose between Medicare Advantage and Medigap plans. For the people that want Medigap plans, these are the choices that I show them. So if you look at the top one, Medigap Plan G, the premium on average for this throughout the entire country is $140 a month for someone who's turning 65 or who's 65. For Plan N, the premium on average is $106, and for Medigap Plan High Deductible G, it's $40 a month. Now, if you take a look at these premiums, pretty much they're about $40. So between Plan G and High Deductible G, there's a $100 difference. Between Plan G and Plan N, there's a $34 difference. So let me go over why this person chose Plan N and why I have constantly told people I think this is one of the best plans to choose, because the premiums are a lot lower and the coverage is fantastic, especially if you're not doing things like going to the doctor and specialists all the time or going to physical therapy and so forth. So Plan G, what is this plan all about? Well, it covers everything, inpatient and outpatient, or Medicare Part A and Medicare Part B, 100% except for $226 for the year, as you can see underneath this doctor. Now, what is that 226? That is your Medicare Part B deductible. With the Plan G, that's the only thing you're going to pay. If you look at the categories here, you see that for the hospital, you're not going to pay anything. For doctors, which is Plan B, or Part B, 226. That's the deductible. Once you pay that, you'll pay nothing for CAT scans, skilled nursing, nothing for any ambulance, zero. Now, the maximum out of pocket, as I show up here, MOOP for the year, would be $1,906. Now, how do you get to this number? I don't know if I put it down on the screen. Of course I did. So I haven't been on this chart in a while. Plan G, 140 if that's your premium. You multiply that by 12, you get 1,680. You add that 226 for the year, and you come up with $1,906. That's all you will pay for the year for doctor and hospital. So let's scroll back up here. So what's the difference between the Plan G, which is the plan that most people who get Medigap plans get? I think it's around, I think it's 34% of the people who get a Medigap plan get Plan G. In the comments, if you know different, you can leave it down there. But it's a significant amount of people who choose a Medigap plan that choose the Medicare Supplement Plan G. And the reason being is because it's very, very clean. You pay your premium, you know you have to pay that $226, and then you're done. Everything else is covered, except for, if I slide down here, the drug plan, which you see, if you're not taking any drugs, there's usually a $5 plan. They can go up to about $35 depending on how many drugs you're taking. This is the premium. And then dental, vision, and hearing, you can get a decent plan for $40 or $50 a month. But other than that, you're covered 100% with Plan G. So if we go back to Plan N, premium's $34 less a month. That's not that much if you really think about it. It could be one doctor's visit or something on some plans. But with this, you pay that $226 for the year, but then you pay up to $20 each time you go to the doctor. I have a lot of clients that don't go to the doctor that much. They just don't. They might say, I go like 3 times a year. Even people that have had heart attacks or something, they say, you know what, that was years ago. I go to my cardiologist once every 6 months or once every quarter, and that's about it. I go to my regular doctor for a checkup or whatever it is. But if you look at the maximum out of pocket, I put here that you went to the doctor 20 times. So if I scroll down here to this Plan N, $106 a month times 12 would equal $1,272. You add that $226 deductible like you would with the Plan G, which equals $1,498. And then you add $200 to that, meaning you went to the doctor 10 times at $20 per time. Now with the Plan N, they can charge you up to $20 each time you go to the doctor. There's not many people that go to the doctors more than 10 times. I shouldn't say not many. There's a significant amount of people who go less than 10 times. So I put in there that you would go 10 times to the doctor, and that would equal $1,698. So let's scroll back up. Let me change this, $1,698. So you're still $200 less than the G plan. That's if you went to the doctors 10 times. Now the hospital coverage is going to be the same. The CAT scans, the ambulance, all of these things will be the same, except for the outpatient visits that you go with the doctor, Part B. But once you pay that $226, it's just that $20 every time. And it's not even $20. Sometimes doctors will charge you $0, some $10. So you never really know. So most of the time, the Plan N is going to end up being cheaper than the Plan G. But for some reason, a lot of people don't get on this plan. And I think I know why. It's because of what they call an excess charge. Now, less than 3% of the doctors in the entire country charge an excess charge with the Plan N, meaning they can charge 15% on top of what Medicare's allotted payment is. So you're basically paying the 15% on top of the 20% that you would owe. It's very minimal. I don't even like talking about it. I just mention it because some people say, what about this excess charge? But 3%, think about that. If I said you have a 3% chance of, getting hit by a bus tomorrow, you would freak out because you think, oh my gosh, it's a bus hitting me. But 3% is next to nothing. If your kid came home and said, and you said, how'd you do on the math test? And he said, I got 3%. You would think you might as well have gotten 0. That's the same thing with the excess charge with Plan N. That's the way I think about it. But some people, I think, don't like that, so they don't choose it. Here's another thing. With the Medigap Plan High Deductible G, the premium is so low, $40 a month on average. Now what happens is you pay 20% of everything until you reach $2,700, as you see over at the maximum out of pocket. But 20% of everything, if you go to the doctor and it's $100, you're going to pay $20 each time you go. And once again, I think a lot of people choose this plan the same reason why I would choose this plan if I was going on Medicare today. Now, the big difference is I'm 48 years old, not 65. I don't know what's going to happen in the next 17 years for my health. Right now, I'm on 0 medications. I go get checked up from the doctor. My cholesterol is not a problem. High blood pressure is not a problem. None of these things are a problem. So I'm not on any medications and I'm in good health. So for me, I always choose high deductible plans because I think to myself, why would I pay $140 a month when I can pay $40? And if you look at the maximum out of pocket, it's less than $1,000 for the entire year if you were to max it out compared to the G plan, meaning $2,700 minus $1,906 is less than $1,000 more if you were to max it out. But if you weren't to max it, if let's just say you never went to the doctors, well, you would only pay $480 for the catastrophic coverage that the high deductible G covers. So this plan is fantastic for people that are in good health and that do not want to spend money on their premium. And so a lot of people call me and say, I would like that high deductible G plan. And of course, they always mention to me, which I mention to people on the videos, that there is a company that if you go with the high deductible G plan, you do not have to go into underwriting, which means health questions, to get on a G plan after 2 years. So on your 2-year anniversary, you can switch into a G plan with this specific company. And I always talk to people about that when they call, and most people mention that. But with the Plan N, like I said, this is the plan that's in the middle. So why doesn't this plan get a lot of love? Well, I think it's because people have the mindset of, and this is what the gentleman told me who called, of all in, I'm just going to pay, and then I'm not going to pay when I go to the doctor, or I'm going to save my money, and then as I go, I'll pay, instead of hitting it kind of in the middle and paying a little bit each time I go and paying a little bit less for the premium. That's just the way people think for the most part. But for Plan N, I think, I don't know if it's just me or if it's the way people over 65 are thinking, but in the future, I think this plan is going to become more and more popular as these premiums for Plan G and other plans like Plan F continue to rise. Now, I love all three of these plans. Some people call me and say, I know it sounds in your video that you like this one as opposed to the next. No, this is about Medigap Plan N. But either one of these three plans, I tell people, if you get these, this is the best coverage that you can get in the United States. Real quick, I want to show you something. These are the Medicare Advantage plans that I usually talk about. When people call, they have a choice. The first thing when you get onto Medicare and get your A and B card is, do I want an Advantage or a Gap plan? And the thing about the Advantage plans, the zero premium plans are very enticing to them. Now, there's certain areas that have great Medicare Advantage plans, but the one thing I tell people is there's 4 distinctive things between the Advantage plans and the Gap plans, and this is why you should get a Plan N, a Plan G, or a high deductible G, is because they have networks. They also, if you go and want to leave an Advantage plan after you've been on it over a year, you have to go into underwriting to get on a Medigap plan. The other thing is that the out-of-pocket expense could actually be more because you pay as you go. Depends on what you do, but that it could actually cost you more. And then the last thing is pre-authorizations, and sometimes these plans do not want to cover all of the things that you do. And with the Medigap plans, I never get complaints with these plans. These plans are the best coverage you can get in the country. I don't wish that my age was 65 or 66 at the time. I don't want to age myself, but if I could get on this coverage, I would get on one of these plans tomorrow. Thanks for watching the video, and I'll see you at the next one.